Can AI outperform doctors in medical diagnosis? New study explores the potential and the pitfalls in the high-stakes environment of an emergency room. The most dangerous error a physician can make isn't choosing the wrong treatment. It is failing to identify the correct diagnosis in the first place. A recent study suggests that a new generation of artificial intelligence may soon become a vital safeguard against these critical oversights. The rise of reasoning models, the medical field is on the cusp of a technological shift driven by advanced large language models, LLMs. Unlike earlier iterations of AI, new reasoning models, such as OpenAI's o1 Preview, are designed to process complex problems through sequential, step-by-step logic. This technological leap is meeting significant demand from the medical community. According to a survey of over 2,000 clinicians, 1 in 5 doctors and nurses worldwide already use AI to seek a second opinion on complex cases, and more than half express a desire to integrate it further into their practice. The study, AI versus Human Clinicians, a study led by Harvard University biomedical data scientist Arjun Manrai, published in Science, tested the diagnostic capabilities of the o1 Preview model against human physicians. The researchers used 2 distinct datasets: classic medical training symptom sets, real-world data from 76 patients treated in a Boston emergency room. The results were striking. The AI reasoning model outperformed both human clinicians and specialized diagnostic software, correctly identifying the diagnosis, or a highly accurate alternative, in nearly 80% of cases. One notable example, provided by co-author Adam Rodman, involved an immunosuppressed transplant patient presenting with routine respiratory symptoms. While human physicians might have missed the severity of the situation, the AI model flagged a suspicion of a life-threatening, flesh-eating infection significantly earlier than the human team. The counter-argument: logic versus nuance. Despite these impressive figures, the scientific community remains cautious. Critics argue that there is a fundamental difference between computational reasoning and clinical reasoning. When we say clinical reasoning, it doesn't mean the same thing as moral reasoning, warns Arya Rao, a researcher at Harvard Medical School. Rao's team recently conducted a separate study evaluating 21 AI models, uncovering a persistent weakness: the inability to handle uncertainty. While reasoning models excel at following a logical path to a conclusion, they often struggle with the nuance required when multiple diagnoses are possible. The primary risks identified include brittle reasoning. AI tends to jump to conclusions too quickly. Lack of nuance. Models struggle when they must weigh several uncertain possibilities simultaneously. Absence of human judgment. AI lacks the moral and contextual reasoning essential for complex patient care. The future, assistant, not replacement. The consensus among researchers is not that AI should replace doctors, but rather serve as a powerful diagnostic extension. The goal is to use AI to catch what the human eye might miss, providing a safety net for clinicians. As the technology matures, the focus is shifting from whether AI can diagnose to how it can be safely integrated into clinical workflows. If managed correctly, this technology could serve as a great equalizer, providing high-level diagnostic support to regions with limited access to specialist medical care. Conclusion: while AI reasoning models have demonstrated a superior ability to identify correct diagnoses in controlled studies, they still struggle with the nuance and uncertainty inherent in human medicine. The next frontier for medical AI lies in clinical trials, aimed at integrating these tools as reliable assistants rather than autonomous decision makers.